I just had to do this video. Welcome to my desk at home. This is Dr. Larry. I'm an ER doctor. I'm going to talk to you about coronavirus, where we're at as of Sunday, March 1st, 2020. I'm going to review the numbers of U.S. cases, death, all that stuff. And I'm going to review this great article in the New England Journal that basically says the coronavirus, now the unknown, we're so much fear of the unknown. Now we know much more about it. And we'll continue to learn more about it. And what we know now is that it's looking more and more like it's just a severe influenza-like viral illness, which is great news. We don't need to freak out. I'm seeing all of these. Oh, there's a case in New York. A second person has died in Washington. And, people are getting freaked out. They're asking me all these questions. I have patients in the ER who are worried about this. And there's people who are immunocompromised, whose immune system is weak, or who are elderly with medical conditions and lung disease who are worried about this. I'm hopeful, and we're starting to get good data that this is similar enough to a severe case of influenza. It does not appear that it's the viral apocalypse. And I want to explain some of that, okay? Let's jump into some of these numbers that we've got right now. I'm going to pull them up on my computer. Excuse me for just a moment because I don't know where that page went. All right, here we go. Number of coronavirus cases worldwide, a little over 88,000 as of today, Sunday, March 1st, 2020. Worldwide corona deaths, 3,041. U.S. cases, 88. Yeah, that's jumped. And there is this community transmission where these aren't just 88 people coming back from China, but it looks like it may be spreading in our country. It's okay. Don't freak out. 2 deaths. The average age, I'm going to review this in this article, the average age and some of the stats. Let's compare that with the flu. 2019-2020 flu in the U.S. 32 million cases versus 88 of corona. 18,000 deaths from influenza. 2 deaths from corona. 125 children have died of the flu. I had a family who an 8-year-old girl had died of influenza. I see people dying of influenza. I haven't even seen a patient with corona. I want that. That's the perspective that I want to share with people, is that getting a flu shot is something people should do. I'm not going to get into that because we're just going to fight about it. But people are dying of influenza in this country, hardly of corona. So those are the numbers, right? Put that into perspective. 18,000 people in the U.S. have died of the flu. 3,000 in the entire world have died of corona, the viral apocalypse. We're all going to die. I'm so excited about this New England Journal of Medicine article. I want to geek out with you in a minute. I want to explain some of this stuff and get into why we think it's similar to the flu. It's brilliant. It's really brilliant public health and statistics, and I'm going to make you love it too. But the other thing that I want you to, the other kind of big picture, this is a belief and a value, and I want to transmit this to you, is that good science here, fear of the unknown, it's taking away the unknown, that fear that is tormenting a lot of people. That is a basis. The good scientific medicine will always lead the way. It's something that we can put our trust in. Look, there's a lot of unknown with this thing out there, but good science, I think, is taking us in a better direction right now. I feel better about it, and so should you. Let's get into this article, okay? You can get this article. You can Google it itself. Type in COVID-19 Navigating the Uncharted. Let me slump down so I'm back in the video. This is by Anthony Fauci, Clifford Lane, Robert Redfield, MD. Thank you to them and the research that is being done, and everybody that's been on the public health, and they really, God, these guys deserve some awards. Okay, so the first thing I want to talk to you about is, so they did this study of the first 450, 500 people, 425 cases of corona, and they studied these people. The average age was 59. And interesting, of those 425, there were 0 children under 15. This is not a pediatric illness. Remember when we talked about the flu killing 125 kids? The flu, there's so many illnesses that do affect children. RSV, bronchiolitis. influenza, affects, attacks, and kills kids in the United States. Interestingly, coronavirus doesn't, at least in the beginning, it doesn't appear to be affecting children under 15. Interesting, right? Also, not the viral apocalypse. Because if the virus is going to wipe us all out, it's going to have to kill the kids too. That's not what it looks like. What it looks like is that the people dying of this, the average age of somebody infected is 59, but those who are dying are even older than 59, which you would expect because they're not as robust. Their immune systems aren't as good. They tend to have more medical issues. So not only are they older, and they have more medical issues like emphysema or cancer or heart disease, all these things that make somebody weaker in addition to older age. And those are the people you think about herd. Those are the weakest that are on the outside, that are the most susceptible to this. We still care about them. That still matters. We still want to do everything we can to prevent anybody from dying. But it does not look like a viral apocalypse that's going to wipe everybody out. It's picking off the weakest among us health-wise, okay? That's what we know from initial studies. Fear of the unknown is starting to evaporate. That should make most of us who are young and healthy feel a little bit better. And those folks who are immunocompromised or have these medical conditions should take the appropriate caution, cautionary preparation, and not get sick. Point number 2 in this article, this is so good. The initial case fatality rate was thought to be 2%. Let me explain that. That would mean of 100 people who got corona, 2 of them died, right? 2% case fatality rate. But what it looks like is that these initial numbers were done on sick people who came in with fevers and cough, sick. So of 100 sick people, 2 of them died, and that was a 2% case fatality rate. But really, as we've learned, most 80% of people don't get that sick. So those initial numbers it only took into account the 100 that came in, not the whole bunch of people who didn't come in. So let's say of 1,000, really, it's probably more like those 2 deaths. There was 100 sick people, but really it was 2 deaths out of 2,000 people, some of whom barely had any symptoms, some who had a little cough and didn't even come in to get tested. And so that assumption, when you look closer at this data, it looks like 2% is actually pretty high. Now compare that to, remember this 2003 SARS thing in Hong Kong? That's why a lot of these Chinese people wear these masks everywhere. They freaked out. The case fatality rate of that was 9%. That's terrifying. That really is terrifying. 9%? I mean, this thing swept the United States. 9%, 300 million people. That's 30 million deaths. That's why people get all worked up. But what we're seeing is that 0.1%, that's like the flu. That is not the viral apocalypse. That's something we can feel better about, Now the second part of it, and then the other one, so that was SARS, and then MERS, this 2012 Middle Eastern respiratory thing, which was also coronavirus, so was SARS. That mortality rate was 36%. That's a nasty virus. That one is even scarier than SARS, even though not as many people died because it was contained. It wasn't as actually, the information says it was, in fact, but that one was contained. So 0.1%, 9%, 36%. You can see the argument that I'm continuing to make with you, which is that this is not the viral apocalypse that we were initially worried that it may be. You buying it? Let me see. Let's see what else. So some people have, it looks like there's this number R0 or R no, R not. That is when I want to explain this. When one person gets infected, it's the number of people that person is going to infect from there. So influenza, similar. It's like 2.3, 2.2. One person gets the flu, they pass it on to 2 people. Those 2 people pass it on to 2 people, and that's how these things spread, okay? And 2.2, it's pretty high. That means it is going to spread, and that's why when we see a case or 2 in the United States, I would anticipate you are going to see more cases of this and it's going to be okay. It's going to have implications for workers, right? So let's say I work in an ER and there's 10 doctors. There's a 14-day home quarantine if you get sick. We're going to have a staffing problem. This thing is going to cause all kinds of problems. What's going to happen initially is, public health wise, we're going to freak out and tighten down. You got to stay at home for 14 days. If it goes widespread, and it might, and if it does, it's going to be okay. If it goes widespread, I would predict that the public health stuff is going to loosen up because of the economic and social impact is going to would be too devastating. We wouldn't be able to staff the ER, just as one small example. That's one industry in a whole country. So I think initially you're going to see things be pretty freak out tight. And then if it gets big, they would loosen up a little bit. And as we get more information about it and we see that it is more like influenza, I think that would loosen up. So anyway, this R naught means one person that gets it 2.2. So 2.2. So one person with corona gives it to 2 other people. Measles, one person gets it and they give it to 16 to 18 other people. So measles doesn't have a high case fatality rate, but it's so infectious and it spreads like wildfire that a tiny case fatality rate means when everybody gets it in the whole world, even if it's 0.001% of 7 billion people, you would have massacred whatever. And that's why that vaccination for measles is important, because it's so incredibly infectious. This thing is infectious. 2.2 is something. It's not crazy like measles. Let me see if there's anything else from this article that I want to talk to you about. So anyway, they think the case fatality rate is closer to 0.1%. What can you do to prevent it? Get enough sleep, take care of yourself, wash your hands, just soap and water, or the 60% alcohol stuff. Hand sanitizer stuff, that's good too. Avoiding places where it is. Don't go to China. Look at the travel advisories. Don't go to a nursing home that has a rip-roaring fever. Avoid those places. This thing is respiratory spread, so saliva, coughing, sneezing, that kind of thing. Typically, you have to be closer than 6 feet, so that's kind of another little factoid to keep in mind. Like, if keep your distance. But we're not even there yet. 88 cases. You probably have not come into contact with it. Although, I would say on the other side, don't forget, we haven't been in testing for this, right? So the United States, people that have been quarantined had come from China. They've repatriated back to the U.S., and we've put them in these military quarantines, right? And then they go home and whatever. The FDA just approved for us to start testing for coronavirus. We're going to start testing. You're going to see more cases. You're absolutely going to see more deaths. The media's going to love it. They're going to eat it up. They're going to put it everywhere. Going to freak everybody out. I would absolutely anticipate this. But you, because you watch this, you're going to know, hey, this is probably just like the flu. I'm going to do the basics. I'm going to wash my hands. If I get sick, I'm going to stay home. I'm going to take care of myself. And you're going to be fine. Now, I will predict 32 million cases of the flu. Are we going to have 32 million cases of corona? I highly doubt that. And I'll tell you why. One reason, not only because there's not a ton of it here yet, it's unknown, right? I don't know how much it is going to spread more, how much, we don't know. But there's no way it's going to be as much as the flu, because nobody listens to us when it comes to the flu. People don't get flu shots, and they don't stay home. They don't stay home. They don't quarantine themselves at home when they have fevers. They go out, they get their groceries. Some people go to work. People are going to listen with corona because they're so afraid they're going to stay home and not go to work and not go out in the community. And so this fear is going to work to our advantage in that respect in not spreading the virus. I don't know what's going to happen. I would absolutely be humble in the face of this thing and the unknown, but I think we're getting more information now, and I would be willing to bet it is not going to be as widespread as the flu with 32 million cases. I don't think we're going to have 18,000 American deaths from corona. That's my opinion. I might be wrong, but I'm putting it out there. Look at this article yourself. It's a great article. I think you can familiarize yourself with some scientific stuff. It's it's a little sciencey, but not too much. COVID-19 navigating the uncharted. I feel better now that we're learning more. We've got the fear of the unknown going away a little bit. Stock market's going to suffer. There are going to be all these consequences. We are going to see more cases and more deaths, and we're going to be okay. I think we're going to be all right. Thanks for watching. Subscribe to the YouTube channel. If you have any questions or anything, you can reach out to me on Twitter or Instagram, Dr. Larry Burchett. See you next time.